So a couple of things I wanted to talk about. Obviously, the variant coronavirus out of the UK, and also another variant out of South Africa have been getting a lot of media attention lately. Those variants have been detected in at least 4 states, as far as I know. So Colorado, California, Florida, and New York have all announced that they have detected the new variant strain in their borders. But I think there's good evidence that the strain is much more widely circulating in the U.S. than that indicates, and that's not unexpected. So this was just posted to the pre-publication server MedRx less than a week ago, and reviews some data that potentially indicate the widespread nature of this UK variant in the US. So as we've discussed, I think before, one of the unique features of this UK variant is that it has this deletion of 2 amino acids in the spike protein. And that means that the gene probe for PCR sequences in a couple of tests for the virus that target that specific area can't pick up spike protein anymore. And so you see a kind of a characteristic dropout of that S gene target where the others remain. And so you have this one gene dropout in laboratory results that can help indicate that this is the variant strain. That's one of the ways the UK is used to track the variant around the UK. It turns out that now at least 2 of the assays used in the US that I know of use a similar spike protein target and are affected by this deletion. One is the Thermo Fisher assay that we mentioned, I think, in one of last week's calls, but also the Helix lab assay that is used by this Helix reference lab has an S gene target that's affected by this deletion, but these other 2 targets, the ORF and N, are not affected. And so when Helix runs this test against a virus that has that 6970 deletion, you would expect that you'll see a positive ORF and a positive N and a negative S. And so what they did is looked at the 2 million specimens that this lab has tested since August from around the country, and looked at where they have this S gene dropout. And what you see is that they have a relatively low level of S gene dropout, less than 0.5%, up until about October. And then you start to see that you have a dramatic increase by the beginning of November in where they see this S gene dropout. Now, this could be coincidental, and it could be a different virus strain that also happens to have this deletion. And so it could have nothing to do with the UK strain, but I think it's obviously much more likely that this reflects the UK strain now circulating more widely in the US. You can also see that it's still a relatively low % of their positive, so it's not yet become the dominant strain anywhere. You can see from the map here, these are the states which have sufficient data from Helix to be able to predict, or at least to calculate a percentage that are this S gene dropout. And you can see the highest is in Massachusetts. They're slightly less than 2%. So still not, by far not the dominant form seen everywhere. And as you know, isn't necessarily close to being dominant in the states that are having dramatic increases in transmission right now. And so, we don't suppose that this has anything to do with the spikes that we're seeing in epidemics in communities across the country. But it is something to note that, not surprisingly, this variant seems to be widespread in the US, and it will probably continue to spread more widely. But again, that doesn't necessarily change how things are going, because our original OG SARS-CoV-2 virus that's been circulating in the US seems to be doing just fine in transmitting from person to person, and doesn't need any extra help necessarily. So this is where we are nationwide, beginning of January. You can see that our case count is kind of plateaued. We had this dip over the holidays, which I think really probably reflects just reporting lags and lapses that occur over the holidays, and we see that in deaths as well. And so that's just artifact. What I think we're going to see is continued high levels above 200,000 cases a day nationwide, and probably increasing, to be quite honest. You can see that the epidemic is now really focused in the West, in California, Arizona, but also in the South again, which has seen an increase again, where they had pretty big wave in the summer. Many of those states didn't have a huge wave in the early fall, but are now catching back up. We're also seeing that other states like Florida, New York, Maryland, New Jersey are not in the extreme risk area, but are approaching that. So when we look at the Midwest, this is what we're seeing. So we had this pretty dramatic epidemic spike in October and November across the Midwest and upper Midwest. And then everybody kind of had a coinciding decrease from mid to late November on. But now what we're seeing across all of these states, including Nebraska, you can't really see Nebraska, it's buried under South Dakota there, but we're all seeing an upturn in cases per capita per day now over the last week or so. And Kansas is the most dramatic, but the others seem to be coming up. Some of this, again, may be artifact in terms of catching up from holiday lag and reporting. So maybe we've just seen a plateau and not necessarily an increase, but certainly we're no longer seeing decreasing rates in any of these states. And some states like Kansas, I think, clearly has a resurgence of transmission going on, probably reflecting holiday activities and so forth. And I think we're going to see that increase even more as now schools are going back in session in a lot of places. This is what we're seeing in the states that are having the highest epidemic peaks now. Again, we're seeing dramatic numbers of cases across California and Arizona. You can see California is reaching per capita rates that are equivalent to what Nebraska had in November overall, which for a state as large as California obviously means huge numbers of cases. But again, we're also seeing dramatic spikes in Arizona, which, as you may remember, was one of the states that really led the summer surge. And so we're seeing kind of a recrudescence of all of that. And again, concerning that many of these other states with very large populations like New York and Florida also seem to be on the rise. And then when we look at cumulative deaths, we see again New York, which had a long plateau where they really didn't have a significant increase in deaths, is now starting to see that rate increase again. And these other states, which didn't have a big spring wave, but in some ways started to catch up in the summer, are now really starting to accelerate more, like Arizona, Florida, California, et cetera. The most concern that we have right now is obviously for hospital capacity. This is a curve of hospitalizations, active hospitalizations in LA County. And you can see that they are still on a very steep slope uprise and are approaching saturation point. If many of these hospitals have already reached saturation point, and they are already implementing crisis standards of care and alternate care sites. There are reports of ambulances waiting 7 hours to get into emergency departments, ambulances being turned away if they have patients who have a high mortality risk and aren't thought to be easily salvaged. And so all of these things that we've talked about in terms of crisis standards of care are happening in one of the most populous counties, actually, I think the most populous county in the United States. So it's going to be an ugly January, and as we discussed, the vaccine rollout probably is not going to help in any way in terms of epidemiology of transmission for quite a while, and that seems to be even complicated more by the fact that dispensing and getting vaccines into arms of people is not going smoothly. So I'll stop there and answer any questions if folks have them.